Guys, TRT can be a game changer or a lifelong mistake. If you jump into it without knowing the risks, you could destroy your natural testosterone forever. Today, I'm going to break down everything you need to know about TRT, what it is, the risks, the benefits, the dosing, side effects, how to get it, where to get it, and whether or not you should even consider it. I'll also cover HCG, estrogen blockers, side effect mitigation, and what kind of results you can expect for real. I'm Dr. Seth Capehart. I'm an ER physician and former special operations guy, and I've spent the last 20 years studying human performance and health optimization. I'm not here to sell you anything, I'm just here to give you the truth. Before we get into it, quick disclaimer, I'm a physician, but I'm not your physician. This is not medical advice. Before starting TRT or any other hormonal therapy, talk to your doctor. Now, before we jump into the details, we gotta ask, why are so many men turning to TRT? This is due to a variety of causal factors. Testosterone levels in men have been plummeting for decades. Studies show that an average man's testosterone levels have dropped by 1% per year since the 1980s, and likely going on even longer than that. That means a 30-year-old man today has way less testosterone than his father or grandfather did at the same age. This is leading to a massive rise in low energy, weight gain, brain fog, depression, and even erectile dysfunction in men young enough that they should never be experiencing that. In comes TRT to the rescue. So, what is TRT and how does it work? TRT stands for testosterone replacement therapy. It's a medical treatment that replaces testosterone in men who have clinically low levels of testosterone. But here's the catch. TRT shuts down your body's natural testosterone production. So when you start injecting testosterone, your body detects that your levels are high, too high, and shuts down its own production because it no longer needs to make any. It's just an excess waste and excess effort. This is a big trade-off. If you start TRT without knowing what you're doing, you could be committing to it for life. First, let's dig into the benefits of TRT. For men with legitimately low testosterone, TRT can be absolutely life-changing. Here's some of what you can expect. Increased energy, strength, muscle mass, improved mood, confidence, mental clarity, higher libido, better sexual performance, faster recovery from workouts, enhanced motivation, and drive. Sounds pretty damn amazing. Some studies even suggest TRT may have cardiovascular benefits, but this is still being debated. Now, I wouldn't be a good doctor if I didn't address the risks and downsides of TRT. One, it shuts down your natural testosterone production, potentially permanently. Testicular shrinkage, because your body stops producing testosterone naturally. Possible infertility, unless you take HCG, which we'll discuss later. Increased red blood cell count, which can increase the risk of blood clots. Elevated estrogen levels leading to gynecomastia, also known as man boobs, and water retention and mood swings. Acne, oily skin, and potential hair loss, long-term unknowns because TRT hasn't been studied in lifelong users yet. So that sounds pretty bad, right? So we kind of need to parse this out a little further. Knowing all that, who should take TRT and who should not? TRT is not, I repeat, not for everyone. You should potentially consider TRT if you have clinically low testosterone confirmed by blood tests, you've already optimized your lifestyle but still have symptoms, or you're older and your natural testosterone levels are declining and impacting your quality of life significantly. Now, who should not take TRT? Young men under 30 with already optimized and adequate testosterone production. This is all too common these days. It just doesn't make sense, and the benefits are not worth the risks. Men who haven't fixed their sleep, their diets, and their stress, anyone looking for a shortcut to muscle growth should not take it. Remember, TRT can be a lifelong commitment. That means a lifetime of stabbing yourself with needles multiple times per week and also getting blood work every 6 months. Also, consider the financial impact of continued doctor visits throughout the rest of your life to manage your TRT. So, if you have decided you want to move forward with trialing TRT, how do you obtain it legally and safely? Step 1. Blood work first. You need to check your total and free testosterone, your LH and FSH to see if your body is actually producing T, estradiol or E2 to monitor your estrogen, hematocrit, and red blood cell count. You can order these labs on your own through a website like privatemdlabs.com. I have no affiliation with them, or you can go through a physician directly. Step 2, you need to find a legitimate provider. Get TRT prescribed by a licensed doctor or TRT clinic. There are a lot of TRT clinics, both online and physical locations. Just Google TRT clinic and you will find plenty willing to help you out. They will get you set up for initial labs, or you can usually provide your own in most cases and they'll accept them. After your labs are back, they will set you up to speak with a provider who can get you your prescription set up if deemed warranted. If you go to a primary care doctor, a urologist, or an endocrinologist, oftentimes they will not prescribe TRT even if you're at the low end of normal. This is really unfortunate, but it is what it is. If you really feel like your levels are too low, go directly to a TRT clinic, as this is what they specialize in. I will throw out a quick disclaimer though. TRT clinics are set up for one thing: making money by prescribing TRT. They are biased and they will push towards prescribing. Make sure that you are doing your research and you know when you need replacement and when you don't. Also, avoid black market testosterone. It's illegal and it's dangerous. This is usually when you are finding the big guy in the gym and asking where he gets his gear. These products are usually purchased in other countries if they're legitimate at all, and you never know what you're getting. I have personally had patients come to the ER due to serious, life-threatening infections after obtaining their testosterone this way. It's just not worth it. It has never been easier to obtain TRT legally. Seriously, easy. So, let's discuss dosing and side effect management. The typical TRT dose prescribed is usually 100 to 200 milligrams of testosterone cypionate per week. This can vary based upon the person, but I always recommend with any medication starting low and going slow. Even if you're prescribed 200 milligrams per week, which is usually what they will prescribe, I recommend starting around 50 milligrams per week and going up by 25 milligrams about every 2 weeks. You need to give your body time to adapt and see how you feel. You should do this until you feel optimized and your blood levels are where they should be. 200 milligrams per week is a pretty large dose and is too much for most guys, sending them into the anabolic range, which will result in a lot of unwanted side effects and increased risks. I would recommend twice weekly injections to help stabilize levels and reduce side effects. The more frequently you inject, the more stable your levels. So if you're doing 100 milligrams per week, then you would inject 50 milligrams twice weekly. There are also some testosterone gels and patches available, but injections are more reliable, while gels absorb inconsistently and they can transfer from one person to another, which is really bad for children and women. So stick with the needle. And you're thinking, I don't want to stab myself with a needle. Well, you may have some hesitancy initially to sticking yourself, but you'll get used to it very quickly. And if you use small insulin subcutaneous needles for injection, you can barely feel it at all. There are plenty of YouTube videos out there that can walk you through the injection process, so I'm not going to do that here. So how do you manage side effects? Let's discuss the role of HCG and estrogen blockers. HCG stands for human chorionic gonadotropin. And basically, this keeps your balls working. You see, TRT shuts down natural testosterone production, causing testicular shrinkage and infertility. So if you started with prunes or grapes, you may end up with raisins, if you catch my drift. And this is not a joke. You will actually notice a marked difference in the size of your testicles. HCG mimics LH, keeping the testes active and maintaining fertility. This attempts to keep your balls at their normal size and is essential for men who still want to have children. But there are no guarantees that it will work, and you could lose your ability to have kids ever again. Keep this in mind. The standard dosing for HCG is usually 250 to 500 IU 2 to 3 times per week. So oftentimes you'll inject on the same days that you inject your TRT. You may add an extra dose in midweek, and this helps keep your testosterone, your natural testosterone going, and your testes at their normal size. So make sure that you account for that if you move forward. This stuff can also be a bit expensive, so just calculate that into your finances. The other medication that is used to mitigate side effects is estrogen blockers, also known as aromatase inhibitors. So should you take them? What happens is the higher your testosterone goes, the more is converted into estrogen, and thus the higher your estrogen goes. This increases the estrogen levels, leading to water retention, mood swings, hot flashes, and gyno, also known as man boobs, making your nipples sore and itchy and making you grow boobs. High estrogen is supremely uncomfortable for a male. Okay, it's natural for women to have high estrogen levels. That's what they're made for, just like we are made to have high testosterone levels. When a man has high estrogen levels, it is very uncomfortable. The medication solution to this is to use an AI aromatase inhibitor such as Arimidex or anastrozole, which is taken usually at 0.25 to 0.5 milligrams twice per week. It is taken orally, but it should only be taken if needed. Again, only take this if you start experiencing side effects. Increased estrogen levels actually help protect you due to the high estrogen levels that you have, but we don't want it getting too high. So there's this fine balance which must be maintained, and that balance is different for everyone. It's going to take some trial and error, repeat labs, and some consultation with your doc to get it dialed in. A quick warning, overuse of an aromatase inhibitors can actually crash your estrogen, leading to joint pain, fatigue, and low libido. So too little is bad and too much is bad. So be careful. So what results can you actually expect from TRT? Well, week 1 to 2, probably no major changes yet. Some say you experience this initial boost, it's likely a placebo effect. Week 3 to 4, more energy, better sleep, improved mood. Month 2 to 3, you're looking at increased strength, better recovery, more libido, better workouts, better pumps when you're working out. Month 4 to 6, full effects are set in by that time. You're looking at better physique, more confidence, higher motivation. And then long-term, TRT basically keeps you feeling and performing like a younger version of yourself. Although this comes with a cost as discussed and not insignificant risks. So the ultimate question remains, should you start TRT? And the answer is frustrating because only you can decide, and it should be in consultation with your doctor. But now you know the risks and the benefits and how to do it correctly. TRT is a life-changing medication for the right person, but it can be a lifelong mistake for the wrong person. Fix your lifestyle first before considering TRT. Watch this video to optimize your TRT through supplements first. If you're serious about getting blood work done, consult a doctor who specializes in hormones. If you're already on TRT, drop a comment. What has your experience been like? Help the other guys on here who have a more full understanding of what it's actually like to be on TRT, what your experience has been. Ask any questions you want answered, and I'll get back to you as soon as I can. If you found this video helpful, please help me out as well by liking, subscribing, and following this channel. Testosterone is power. It's time to reclaim yours. I'll see you on the next one.